mynews.studio.
On Valentine's Day, a baby girl weighing just 1.7 kilos became the first to survive in Sierra Leone's new neonatal intensive care unit. The story behind it involves a global sock club. Would you have guessed that?
Today is February 22nd, 2026. Let's start by putting this in perspective. Until last week, if a premature or very sick newborn was delivered anywhere in Sierra Leone, there was no NICU, no incubators, no specialized staff, nothing. Now, the Paul E. Farmer Maternal Center of Excellence has opened, 166 beds, and the country's first NICU. Why does this matter so much?
The numbers tell the story. In 2020, Sierra Leone's maternal mortality ratio was about 1 in 52 women dying during pregnancy or childbirth. For context, in the United States, it's about 1 in 3,800. Since 2000, maternal mortality in Sierra Leone has dropped by 79%, but that still means around prematernal deaths every day. Previously, the whole region had just 48 beds for maternal care. This new facility more than triples that, and crucially gives preterm and low birth weight babies a real chance, something that just wasn't possible before.
How did this happen? It wasn't a billionaire writing a check. Instead, it came from 6 years of grassroots fundraising led by John and Hank Green, their online community, and Partners in Health. How did they actually raise $50 million?
Their approach was quite different. They launched the Awesome Socks Club and Goods Store, selling socks, coffee, tea, and soap. Over $12 million in profits went directly to Partners in Health. Add their annual Project for Awesome charity live streams, direct donations from the Green Brothers, and thousands of monthly donors. Most of the money came from regular people buying everyday products or giving small recurring amounts. It's a model that pushes back against the idea that only huge foundations can make big changes.
But just raising money doesn't guarantee results. What set this project apart in terms of local involvement? Was there any risk of it becoming just another foreign-built, foreign-run hospital?
That's an important point. Partners in Health worked alongside Sierra Leone's Ministry of Health from the outset. The construction crew was mostly women, and 200 clinical staff were trained locally, including 51 midwives. Now, Sierra Leoneans run and staff the center. John Green himself said the real heroes are the people in Sierra Leone who built and now operate the hospital. It's about local ownership, not outside intervention.
And the government is making this part of a bigger national strategy, right? What's the wider context for health in Sierra Leone right now?
Exactly. The government's strategy rests on 4 pillars: expanding primary health, strengthening referral and emergency care, and improving secondary and tertiary hospitals. Right now, about 85% of Sierra Leoneans live within 5 kilometers of a health facility. With the maternal center open, they're aiming to bring the maternal mortality ratio down to below 300 per 100,000 live births by 2025 or 2026. It's ambitious, but the progress so far makes it seem possible.
Let's talk about the technology. What's available in this new NICU that wasn't there before? And how does that change things for newborns?
The NICU now has incubators for premature babies, emergency crash carts, 24/7 electricity, and biomedical monitoring devices. None of that existed anywhere in the country before. Staff have been trained in neonatal intensive care and emergency C-sections. They can now regulate temperature, provide respiratory support, and respond quickly in emergencies. For a baby born at 1.72 kilos, like the first patient, these resources make survival possible.
Sustainability often comes up. What happens once the initial $50 million is spent? How do they make sure it keeps running and staff stay trained?
The hospital is government-owned and built into Sierra Leone's health system. Partners in Health keeps providing training and wants the facility to become a rural teaching center. They're building on national programs like PresTrack, the pregnancy tracking system, and continuing midwifery training. The hospital hires locally, and operations are set up to keep going after the initial funding.
Do you think this grassroots plus local partnership model could be used in other countries facing high maternal and infant mortality? What might block it?
The main lessons are the power of grassroots fundraising, using things like the Awesome Socks Club and Project for Awesome, and the importance of working with local governments for real integration. But it only works if there's local hiring, training, and design that respects dignity. Challenges include underfunding, gaps in infrastructure, and the need for strong political will and good data. These are tough, but the model shows it's possible.
And for people like Gab Rima, who bought socks or coffee and followed along for years, seeing that first baby survive in the NICU must make all those small actions feel meaningful. Does this change how we think about global health stories?
It shows that sustained collective effort can tackle really complex problems. The survival of that baby girl isn't just a medical milestone. It's proof that communities, when mobilized, can drive real, systemic change. It's a rare moment of hope in a field that often feels dominated by crisis.
So, just to sum up, a 166-bed hospital with the country's first NICU, funded by grassroots action, staffed and run by local people, and designed for long-term sustainability. It's closing health gaps, not just for Sierra Leone, but as an example for other countries. And all this started with people buying socks and coffee.
Thanks for joining us. Today's story is a reminder that even small, steady actions, when combined with community and local leadership, can shift the odds on problems that once seemed impossible.
Thank you for listening. This episode was brought to you by mynews.studio. You can try it now for free.